I'm Kevin Rose, and I'm a board-certified plastic surgeon. There are a lot of surgeons out there that will claim to be cosmetic surgeons, and I'm sure some of them do a fine job, but the thing that's important about being a board-certified plastic surgeon is you have a very standardized way of evaluating physicians and their knowledge and also their abilities to complete certain procedures safely. See, the problem is that some people will do the surgery, but the results aren't always quite as good, and they may take risks that they really shouldn't. And so as a board-certified plastic surgeon, we provide the highest quality of care at the safest level. I really make sure that my surgeries are very tailored to the patient experience. See, the thing is you really have to be able to get into the patient's head to understand what their expectations are and what their needs and wants are. And if the communication isn't there, then a lot of times that will fail. And so I really feel that providing a safe surgery that is realistic and also relatively on the conservative side. And so when they come to the Rose Clinic, I think what they get is a very thorough evaluation of their anatomy in a dimensional way so that they get something that's nice and proportionate to their body. When I see patients, sometimes the timing of what they want is not right. If patients have had significant weight fluctuations and they're deciding to breastfeed, they still want to have kids, they want to like look good now, but the problem is if they do the surgery now, then they're going to mess up the surgery and they're going to have to redo things. So sometimes the answer is unfortunately no, and I don't recommend that people have surgery. If it's unsafe, we would for sure not do the surgery, or if the timing is just not quite right. Unfortunately, sometimes it's better if people lose additional weight before they jump right in and have a tummy tuck, for instance. Some physicians would jump right in and do surgery on them, and I would tell them, if you're planning on losing more than, say, 30 pounds, then you should probably, do that, come back, and you will always look so much better. An educated patient is so important. I would rather have them ask me 100 questions and spend hours talking about it as opposed to having no questions whatsoever. That way I know that they have a complete understanding of what they're doing, because it's such an important decision to make. Consultations are totally free at the Rose Clinic, so make an appointment, come in, and we'll talk about any questions that you have. I have a lot of friends who, unfortunately, don't necessarily love their job, but I absolutely love my job. I love getting up in the morning. It's so easy to come to work knowing that I'm going to go and be able to change someone's life permanently for the good. Nothing could be better. It just makes me happy.